Hello, everybody. Good morning or good afternoon. Welcome, welcome. I would love to hear from you in the chat where you're tuning in from. And I would love to know what you're excited about for the new year, if you're inclined to share that. We're gonna give it a few minutes to let people trickle in here. Hi, Julie. Today's webinar is going to be Diversity Matters, raising awareness about cultural competency in the holistic health field. I am going to be your host, Felicia Royce. I am the Director of Alumni and Career Services, and I will introduce Taryn here in just a few. Hi, everyone. We're going to give it just another minute. Got North Carolina, Ohio. I'm wondering if it's freezing cold where everyone else is. We're about to have a really snowy and icy weekend here in Portland, Oregon. Well, I'll have people continuing to trickle in, but I'm going to go ahead and get started here. So just a brief introduction. I just mentioned who I was. I'm being joined today by Gina Schnaps. She's our marketing manager, and she's actually going to be just in the background, making sure that things are working smoothly. If you have any tech issues, please let us know, and Gina will do her best to help. Prisca Bermudez is the Director of Student Services. She is joining us today, and she's also going to be in the background, kind of keeping an eye on the chat. You might see her name pop in there. She might be answering some questions or adding to the discussion. And then I want to just go over our mission, our vision, and our commitment to diversity and inclusion. So our mission is to lead the advancement of evidence-based integrative health and wellness education through experiential online learning and sustainable practices. Our vision is integrative health and wellness education is accessible to global communities, promoting sustainable and healthy futures for all. And then our commitment to diversity and inclusion is ACHS's diverse student body includes working adult professionals seeking a career change, lifelong learners who are interested in the holistic health field, and healthcare professionals seeking continuing education. And I am going to just go over some brief housekeeping items. So we are going to be doing a panelist interview, and I'm going to introduce you to our speaker today, Taryn Wright. But I just want to kind of mention the style of this webinar. So Taryn and myself are not experts. I'm not representing ACHS as a diversity and inclusion trainer. We're not here to give advice. We're here to facilitate a conversation. And Taryn is going to be sharing her story and her lived experience. So she's going to be just, talking from her own experience. And I just want to acknowledge, we're going to be talking about diversity. We're going to be talking about inclusion. We're going to be talking about racial barriers and a very important topic. But being a white-bodied woman in a predominantly white field, it's not my story to tell. And I just want to acknowledge that, we are here to have a discussion and not be experts. So I just want to put that out there. We're also going to be talking about things that might bring up some feelings and might be uncomfortable. And so if you are a student here at ACHS, you do have on-demand counseling through Timely Care. Please use that if you need to. And if you want to talk about something offline, or you need resources, or you need some support after this, please reach out to me and I'd be happy to talk to you and get you those resources. We want this to be really interactive. We want to hear from you. We want to hear your experiences, but I do want to just share that this is a recorded webinar. And so please only feel free to share the things that you're comfortable sharing. So I just wanted to get those housekeeping things out in the open there. But without further ado, I do want to introduce today's panelist, Taryn Wright. Taryn graduated from ACHS with her master's in herbal medicine. Taryn's also an acupuncture student and has some big plans for her future in the field. So I just want to turn it over to Taryn. And again, I'm going to be facilitating, but this is Taryn's floor and her platform to kind of tell her story. And Taryn, if you don't mind, maybe starting by just giving us a little information about yourself and your background.
Okay. So I'm Taryn Wright. I'm also a first generational student and, the first person in my family to have interest in the holistic field. I received my bachelor's of science degree in Charlotte, North Carolina at Johnson C. Smith University. And of course, as Felicia said, I have my master's from ACHS for herbal medicine. And then I also have my certification of a Reiki master practitioner and also a spiritual life coach. So I wish I would have known everything that I know now because my mother, she had cancer, diabetes, high blood pressure, high cholesterol, glaucoma, like she had everything. So I wish I would have known so much about herbal medicine, acupuncture, just energy healing. Because I feel like, or just basically focusing on preventative issues, because I would have gave her that knowledge, hey, go to an acupuncturist, hey, take some herbal medicine. Um, yeah, so that's about me. And
Yeah, sorry, Taryn, go ahead. I did. If
no,
you
that's
want.
fine. That's it.
Yeah. Well, and I just want to say I've had the pleasure of working with Taryn over the last year. I've gotten to know Taryn really well, and I really appreciate your tenacity and wanting to help other people. And I just want to say that it's been really lovely to work with you.
Thank you.
Yeah. So moving on to kind of our first question here. What is your definition of diversity?
I feel as if diversity is like multiple individuals that comes from different backgrounds, different cultures, um, where they grew up. You have East Coast, West Coast, everything is different. So it's a particular group and certain individuals in that specific group. And I feel as if diversity is very, very important because we want everyone to feel comfortable. We don't want anyone to feel uncomfortable. Uh, and that's like for myself, like I stated earlier, Reiki, it is rooted in Japan. It comes from Japan. Acupuncture was 3,000 years, it is 3,000 years old, and it's rooted in China. And then you have herbal medicine, TCM, from Africa, India, even the Americas. So, and also China. So it's like so many different backgrounds, and some of it is Buddha tradition. So it's like so many different religions that's also incorporated into holistic health. And that's why I feel like this is very important because we can all learn from one another.
Absolutely. And I'd love to hear from the audience, what is your definition of diversity? I'd love to hear all perspectives on diversity. So if you feel inclined, feel free to use the chat and have that discussion as well. But thank you so much for expanding on that.
Right. And also inclusiveness. We all want to feel included. So when we have inclusiveness, it helps us build that trust all together for, the holistic health in the health wellness. So I feel like building trust has a lot to do with diversity as well.
Absolutely. I agree completely. Wonderful. So the next question would be, move my screen around here a little bit. Where and why do you see a need for diversity, inclusion, and equality within the holistic health field? And feel free to share any experiences that you might have.
For example, have you ever walked into a room and felt very uncomfortable as being a Black man, Black woman, Hispanic man, in a predominantly white area? It can feel uncomfortable. And also the stereotyping of, the Black woman. If we're not doing enough, uh, we're gonna get looked over just for being who we are today. Uh, and that's an issue because we're not aggressive. We're just passionate about our work. So if we don't do enough, we're going to get looked over. And if we do too much, oh, we're aggressive. We're being competitive. We're doing too much. So, and I want to share an experience. I went to a job interview, the only Black woman. It was for an acupuncturist because I go to school at the moment, and I wanted to get a job to see how, the feel of being in an acupuncture clinic. I felt very uncomfortable just walking in the room. I'm like, okay, it's not, that diverse here. So that's one situation. And not only that, I've had professionals just laugh in my face for not knowing or understanding a specific question or task. And that could make me feel low. So it's like, now I have to do more research in order to, so I can know what I'm going into. So I will not feel uncomfortable. So,
Wow.
yes.
And that's one of the first conversations that I had with you, right? Like in my role, working as a career support, a career coach. Taryn talked to me about this experience, and it wasn't the first time I'd heard it. And so Taryn and I talked about how it would be super important to do a webinar like this because it wasn't the first time that somebody came to me and said this was their experience. So I really appreciate your being vulnerable and talking about that. And I'm looking at the chat and I don't think you're alone, right? And so I think that that's why we're having this discussion and bringing this to the forefront. I love what Stacy said. Diversity to me is a mix of different cultures, backgrounds, traditions, and beliefs. Looking to see if there's anything. Representation matters. Teresa said, sometimes I feel that I have to work twice as hard and be better than everyone else.
Exactly.
It's kind of in a nutshell what you were saying, right?
Exactly.
Yeah. Is there anything else you want to add as far as where you might see that, like going into this field, like maybe where you might want to see more of that, just from like you had mentioned to me, you're the only African-American person in your school, right? Like in your acupuncture school, right? And so do you want to expand on that at all? Like just the need for other voices in the classroom? And I don't know if you feel comfortable doing that, but
I do. It's okay. It's been kind of difficult. I'm not gonna lie. Like I stated earlier, you have to work as twice as hard. And even, some professors, they may look at you differently just from researching and trying to understand certain, things about, for me, acupuncture. It's been kind of difficult, or it's been like, if this just happened to me not too long ago, to where it was a woman that just looked at me on an elevator the entire time, like I didn't belong there. And I'm like, I do belong here. So it's like, I have to gain my confidence and just be me at the time. So I just feel like the whole stereotyping, it needs to, minimize, because no one wants to have a me versus them mentality. We all need to come together so we can continue to heal everyone.
Yeah. And all of the different perspectives that people can bring with all of their different backgrounds to an employment situation or to a classroom situation. How vital that is, right? So that's awesome. Thank you everyone for continuing to have this conversation in the chat. Julie said it is a deficiency. Oh, there's so much and deficiency for all in education, but there's a lack of diversity in all areas, such as students, faculty, staff. Yeah, exactly.
Exactly.
Exactly. Well, thank you so much for sharing, and we'll move on to the next question here. Well, you've shared some hurdles already. So,
Right.
this question's already kind of been answered, but is there any other kind of hurdles or challenges that you faced as an African American woman in this field? And I'm really curious to know how you've overcome some of this, or,
Okay.
I'd love to hear some examples of, you know, how you're
Well,
able to get past well, and not even get past it, right? Just
exactly.
be in it, right? Like that's how are you in that space? How do you handle that?
Right. So hopefully someone can give me advice as well, in a chat or on this in this webinar, because I'm still trying to continue to remain confident. So I just want to support the underrepresented communities so they can know more about the holistic health field, because I come from that background. I've stayed in multiple underrepresented communities, so we have no knowledge of holistic health at all. So I'm also trying to continue to work on the statement of working twice as hard. I feel like I'm still working on that in
Yeah,
due time. In due
yeah,
time.
yeah.
So I don't want to work as twice as hard just so I can be seen. I want to be seen just for being authentically myself and the knowledge that I know. Like
Absolutely.
if, yeah. So I'm still these challenges, I'm still overcoming them. So if anyone know, and not only that, support,
Mhm.
support from anyone. It's very difficult because, like I stated earlier, the African American community, maybe the Hispanic community as well, they don't know too much about holistic health. So even if I'm a prime example for myself, I can go to my family and say, hey, why don't you try to go see an acupuncturist or take some herbal medicines for this reasoning? They're not going to do it because they don't know anything about it. So I want to help. So I'm still working on these challenges. So like, hey, here's this information. They sometimes just don't want to hear it at the moment. Well, this is and maybe everyone else is going through that. It's in due time.
Right, right, right. Yeah, and I don't even know, like in reflection, I don't even know if like it is even appropriate to say, how did you overcome this, right? Because
Right.
that's I don't know if you can overcome, right? It's more
Exactly.
how do you work within, and how do you find that representation for your communities, right? And like,
Right.
so maybe that should have been worded even a little bit different. See, I'm still learning as well.
Exactly.
Yeah, thank you so much for sharing that again and being so open. Um, I'm trying to look in the chat here just to see. Um, there's Charmaine said, because it's like you don't know anything, everything, neither does any one person in a different culture. We can all know and learn more. So shine in what you
Exactly.
know and be confident there. You're paving the way.
Exactly. Thank you.
Beautifully said. Beautifully said. Are you able to advocate with others expressing the same hurdles as yourself? Is this a great outlet? Is it a great outlet and way to bright light through actions, just a thought? Are you able to?
No, I'm glad you stated that because I actually want individuals to contact me so we can, come together as one. It doesn't matter if you're 2,000 miles away, we can all come as one and go to the high schools, go to public libraries, go to, school programs or HBCUs and get this out there. So, no, I really want to advocate for that. I'm very passionate about that. So all of the communities together can come as one, not just my community, like, everyone. So we can all come together.
Can you expand on that a little bit as far as ways that you've seen that implemented? Like, could that be affinity groups? Could that be because you bring up a good point that now with technology, we can start to get people together from, one person on the West Coast, one person on the East Coast.
Right.
Have you seen any implementation of that you think we could, talk about a little bit in this webinar?
No, but it's possible. I feel as long as we have that communication, like, hey, we start a group. Hey, I'm going to this high school this week. I spoke to the principal. I'm doing this at this school. I'm doing this at that school. So it's possible,
Yeah.
It's definitely possible.
Yeah. Great. All right. Okay, so where can minorities and BIPOC find support, people of color? Where can this be enhanced?
Like I've stated earlier, the underrepresented communities. I came from that area. Like I've stated earlier, like there's no knowledge of holistic health. We didn't know anything about herbal medicine or acupuncture, or Reiki. So it's like it just has to get out there, and yeah, it's gonna be difficult, but it's possible.
Where have you found systems of support?
It's been difficult. So hopefully, this webinar is a start. Um, it's difficult to get support from family members. It's difficult to get support from honestly anyone. But other than that, Felicia, she's been, oh my God, she's a goddess because she's been really, really giving great advice, telling me to keep going. Email me, check on me to make sure I'm okay. So that's what I want. I feel like we all need to come together and support each other because I feel like it's a lot of people out there that don't have support.
Yeah, and maybe that kind of answers the question of where we see that to be enhanced, right? Like maybe we need to create more support.
Exactly.
And I'd love to hear people, chiming in the chat of what support systems have worked for them or not worked for them. I would love to see that. One thing that I really, and this is just on a side note, personal side note, one thing I've really appreciated about my interactions with Taryn is the fact that we can have these really hard conversations together. And it's really, I've learned so much from Taryn, and she has allowed me to ask questions, and we've had this like wonderful dialogue about these really important and tough topics that are hard to tackle and hard to nail down. And I just have really appreciated the openness and the ability to ask questions. And I think that that's something else that we can just keep encouraging people to do, keep having the conversations, keep talking about it, right? So, yeah. Let's see. Phyllis said training students and employees to be leaders. I'm going to mention a book later, but there's a book that I just read called Room at the Table, and it talks about a lot about leadership, and it's a great book. It is concerning too how research medicine and holistic health lacks diverse subjects included in the studies. There are gaps in what we know about how to assess and treat various races and ethnicities. Yeah. And Jill says, my definition of diversity relies on intersectionality, a term coined by Kimberly Crenshaw, which describes how a person's various marginalized identities work together to impact a person. For
Exactly.
example, yeah, profound. For example, if someone is working class and has a disability, the combination of both factors shape a person's life experience. Huge.
Yes.
Thank you, Jill, for sharing that. Is there anything else here? And if I'm not getting to your comment, I'm really sorry. I'm trying to read them all here. Opening this conversation with the diversity of students listening is a great start. Thank you for saying that. Yeah, keep the comments coming. Okay. So how can cultural competence be integrated into the holistic health field?
Mm.
in your
Uh,
opinion?
Diverse training, education, uh, becoming professors, or going back to the communities that you come from, so we can explain like, hey, holistic health is for everyone. We are going to feel comfortable. Like I stated earlier, I would love to go to the schools, and not just myself, even if I don't care what color, white, purple, blue, we all need to come together. So even others on the outside can see, like, oh, this is very diverse. I will feel comfortable. So, and also community engagement, outreach programs. Uh, and like I've stated earlier to Felicia, like I said, diverse is a very important topic because, like I've stated earlier, I want to have my own clinic in the future to where I have naturopathic doctors or hypnosis, life coach, and, all from different backgrounds. So it's very, very, very a passion of mine to have all types of different cultures involved.
Mhm. Yeah, like in a wellness center setting where you have people from all backgrounds bringing their talents and skills forward to the clients that you're going to be serving.
Right.
Yeah. I'm going to throw you a question. As far
Okay.
as thinking about, there are probably people on this webinar that already own businesses and some that
Right.
aspire to. And I'm curious if you have any thoughts on how somebody might be able to start. And we'll go over this. I have a slide on it
Okay.
as well, but just how to start bringing that into your business. Even at the very beginning, like, do you have any thoughts on like how you might be able to start with that? Because trainings are great and I hope everyone, goes into trainings and stuff, but just what are some just initial things that you can think of that people can start doing to be more culturally competent within their business model?
Honestly, I'm gonna be honest. I know maybe this wouldn't have worked, in the past. Social media.
Hmm.
Social media is huge right now. So I feel as if social media is all kind of people out there, and you can contact a lot of individuals, like-minded individuals. So I feel as if social media, having confidence, being your authentic self, and planning. I feel like planning is very important.
Mhm. Yeah, planning and building a framework and
Yes.
just being aware. Uh,
Yes.
yeah, that's great. Um, again, I'd love to hear from other people about their thoughts on cultural competency and in the holistic field professionally. If you have a practice and you are approaching cultural competency in your practice, I'd love to hear about how you do that.
Right.
That you might have. Again, we're all learning here. This is all a conversation to come together and just talk about what we might be able to do
Mhm.
as practitioners. It's definitely something I've had to think about for my own holistic health practice.
Right.
Uh, so feel free to keep chatting. Um, oops, I think we missed a slide. So what are some of the resources that we can share with our audience today? Gina is going to send out a couple of links in the chat, but the National Center for Cultural Competence is a great resource. They have a lot of really great tools on there, including assessments. There's something called the Community Toolbox, which I really got a lot out of, and Gina will send this as well. I had mentioned books before, but books such as Racial Justice at Work and Room at the Table are some other really great books to read. The National Institute of Health has some really great articles and research on cultural competency. And again, that link, I'll be providing that as well. And there is a book list in there. There's tons of books, there's tons of podcasts. A lot of really great information out there. I also want to compile resources to send out at the end of this webinar. So if any of you that are in attendance here have any resources, I would love to hear them. Any books you've read, any podcasts you've listened to that have been impactful to you. I'd love to get all of those into one resource and send it out to share with everybody. So please feel free to comment with any resources that you might have.
Yes, that would be wonderful.
Yeah. So we are going to open it up here in just a minute for some discussion and Q&A for Taryn. But I did want to put together just a little slide for some things that you might be able to think about or reflect on as you think about incorporating some cultural competence within your holistic practice. So being aware of assumptions and stereotypes, which we've talked about a lot today, doing some self-reflection, I think is always important. Adopting a strength-based approach. And I got most of this from the National Institute of Health. And I was like, okay, I want to learn a little bit more about the strength-based approach. And so I looked that up, and what it says is it's the opposite of the deficit lens. It's the strength-based approach, which acknowledges diverse patient contexts and recognizes patients' resilience, knowledge, capabilities, strength, and abilities, using language regarding strength and not, like strong stories and not bad stories to highlight experiences. And I think that's really powerful to take that approach versus sometimes what we do, and I've totally been guilty of it, is just apologizing for somebody's experience. Like, oh my gosh, I'm so sorry that you dealt with that. Instead, taking the strength-based approach and acknowledging the resilience and the capabilities of another human. So ensuring inclusivity and research within the field, I think that's a really, really important one. Expanding the scope of inclusive healthcare delivery, I think that's a really big topic, probably its own webinar. But advocating for a more inclusive healthcare system is vitally important. Self-educating on diversity in all of its forms. I think, again, that goes back to self-reflection and building individual and institutional commitments. So having a framework, knowing how to approach, different situations that might come into your practice, right? Like that, have a protocol for that.
Right.
And then one thing I think is, really important is having a culturally competent intake form, asking questions, especially talking about like holistic nutrition. There are some people who don't eat certain things because of their religious preferences or their preferences in general. We have culturally, there's such a diverse amount of things that people come in to see you with and from their background that we don't even think about. And I say we as in me. Like sometimes I've been in that situation where I'm like, I ask the same people the same questions, right? And that might not necessarily be serving my patients the best. And so thinking about like asking about preferences, asking about like, are there certain things that aren't going to fit into your culture that maybe I offer as part of my services here. So I think just asking those questions and making sure that people's preferences is really important so that you can be aware of that. Do you want to add anything to that, Taryn? Just you've probably seen your fair share of intake forms and you've done your fair share of intakes in your clinic that you're doing now. Do you want to add anything, something that might be on that form that would be helpful or anything at all that you can think of?
Only thing I could think of is what you stated, and also like family history. I'm guessing that's a huge difference, but that coincide with what you said, like someone's background, someone different. So like on the intake forms, it always say, family history. Who had this, and it's so sadly I have to check all of them. But that will also let practitioners know, like, okay, she comes from a different background, high blood pressure running her family. I wonder what kind of food she intake. This, or what the family intake, or if she changed her lifestyle, you know, so they can prevent that. So that's the only thing I can think of.
Yeah, yeah, just expanding a little bit and
Right.
yeah. Yeah, maybe even just like having a section where people can write out what their preferences are. You know,
Exactly.
yeah. Any questions about any of this or any comments, please keep those going as well. Anything that you're doing in your practice, with your intake forms, we would love to hear as well. So please feel free to keep chatting there. And then I just wanted to read these quotes. I just recently read the book Room at the Table. I know I've mentioned it a few times, but I thought these were kind of powerful quotes from the book. So it says, sure, the world has changed a little bit. We are still living with residual consequences of deeply planned and strategized actions, gender oppression, class discrimination, and racism. They remain steeped in our society. Ignore it, and it will continue to have a negative consequence it will continue to have the negative consequences that it was designed to have. Equity leadership sets a vision for that affirming, seeing-oriented, hearing-oriented, active healing space that cultivates our best and healthiest selves. And I thought that was a really great quote by Dr. Renee Branch, Canada. And I highly recommend the book. There's one more quote that I added in here just about, diversity and what we've been talking about today. So none of us have come from the same place. We must learn to acknowledge difference and not dismiss it. You'll be encouraged to tap into your personal stories and lived experiences to better see opportunities and spaces where privilege or lack thereof has shaped your thinking, seeing, and doing. So I think that kind of goes back to the self-reflection piece.
Right.
Yeah. So I thought those were really great quotes. And with that, I just want to open it up for thoughtful discussion. Also questions for Taryn. Taryn has been through a full master's program in herbal medicine. She's been in acupuncture school. She's been seeing clients through her clinic. And I would love thoughtful questions for Taryn. We have about 15 minutes to just open it up. If anyone wants to bring anything up in the chat, we'll just take this time to talk about whatever is needed. And I haven't looked at the chat in a few minutes, but I'm going to go back and see what people have mentioned here. So Kashandia said, I want to start my own business here in Mississippi. They lack knowledge here on the holistic approach, but they are asking for naturopathic services. I am disabled, but I want to help others. How can I get started while I'm in school? Kashandi, are you asking how you can get started helping people with the holistic approach? I definitely want to answer your question. I just want to get a little clarity there. So feel free to type in the chat if just so that we're answering that question appropriately. So Brandy said, what does your daily life look like? Like maybe as an acupuncture student,
Right.
could approach it that way.
Okay. As an acupuncture student, I'm just learning at the moment. Very interesting, very energetic. So I was just speaking to one of my professors about this. She's been doing it for a while. I'm working on energy. So if I'm going to be around a lot of patients, I don't want to take in their energy. So I'm trying to learn this before I actually start clinicals because I'm in preceptorship. So that's what I'm doing at the moment. Just learning, enhancing in any way that I can, studying, meditating. Oh my goodness, I have to meditate in order for my day to be at a perfect level. Now, I'm not going to say perfect, nothing is perfect, but in order for me to maintain my day, I have to meditate as soon as I wake up. Because if I don't, my day is going to be all over the place. So that's my day, meditation. I do some qigong from time to time. Um, yeah, that's my day in studying.
Lots and lots of studying.
Yes.
I have a follow-up question to that. And
Okay.
so when you studied here and got your master's in herbal medicine,
Mhm.
obviously there's a lot of Western approaches to
Mhm.
herbal medicine, and now you're in Chinese, like studying Chinese herbs. Um, how are you going to combine the two things,
Ooh,
the herbal medicine and uh, the acupuncture?
this is a great question, Felicia. So I feel like herbal medicine and TCM very similar. Is just kind of different in some areas. Like for example, acupuncture medicine. Well, TCM. It's more on the channel. So you have so many channels, meridians, and it's for certain channels. Like if you're too hot, you're not going to take a warming herb. For example, myself, me taking herbs, and understand I was trying to take some Korean ginseng, but I'm more young, I'm more hot, I'm more warm. That is a more warm herb other than American ginseng. American ginseng is more cool. So it's very interesting. So I had to take that out of my diet and use American ginseng. So how I want to incorporate it is in due time. I'm gonna have to figure that out.
Yeah, but it sounds like you
Yes.
like a wellness center where you want to kind of approach kind of a wraparound service for your clients where
Ex-
you have acupuncture and you have consulting and you have an ND present, and
right. Right.
that's
It's a very
awesome.
interesting. Yes.
There's two questions that go hand in hand here. How do you plan on using your gifts to serve your community, and what kind of clinic do you have? But maybe it should
Okay.
be, will you have? So how do you plan on using your gifts to serve your
Right. Um, how do I plan on using my gifts? I'm a I'm more of on the spiritual aspect. It's kind of difficult to explain. So what kind of clinic I want a naturopathic doctor, like I said, a hypnosis, anything that can find a root cause of any illness or any preventative issues. Like I said earlier, genetically, my mom had everything, so I want to prevent that. But on the spiritual aspect, that's what I want to focus on more in my clinic. I want to, we have childhood trauma. We have trauma, and maybe that's trauma that's built into who you are today, that's holding you back from moving forward in your life, or that's causing you illnesses, any illness, honestly. So I feel like yes, so I really want to have more of a spiritual aspect in my clinic, and a very diverse clinic. And that's about it.
That's awesome. Thank you so much
Yes.
for sharing that. I'm so excited. You'll have to come back and do webinar round two when you
Of
have your
course.
clinic up and running, and yeah, that'll be really interesting to see how that all comes to fruition. So let's see here. Phyllis said, how can we help decolonize these practices within our community? A lot of these things, unfortunately, have been condemned as evil.
Exactly. I'm glad you said that. Oh, I'm sorry, Felicia. I got excited when
Oh, no, I was gonna send it to you. So,
So great question, Phyllis. We're gonna have to get each other information because I've noticed my family, like anytime I say anything about acupuncture, they saying, "Oh, you're gonna do voodoo on me," and I'm like, "Yo, like, do you understand how this can help you physically, emotionally, spiritually?" So we, I'm glad you made that laughing emoji, but we have to come together and figure something out so we can get that education out there, we can get that knowledge out there, because like you stated, like people think it's evil in our community and we have to be that change, we have to let others know. So yeah, you're welcome.
Roy has a support group. I do not want to missay this name. Yahweh.
Mhm.
Health Awakening and Support Group. This is what I'm working on in Columbus, Ohio. I'd love to know.
Nice.
Also a place for that.
Yes.
So, for those of you that are interested in connecting, please, let me know, say yes in the chat, and I will compile your contact information and share that with your permission, to be able to start networking, because I think that's important. So,
Yes.
let's see here. Thank you. Yeah, everyone, please, the network. Yay!
Yay.
Let's see, I know I've missed some stuff up here, so let me kind of backtrack a little bit. Jasper says, I'm very thankful to be in such a diverse school with a safe space. And my goal is to extend that out to as many as I can who seek it in my community. Thank you for sharing your truth, Taryn. I love that.
Thank you. Thank you for listening, everyone in this chat, in this webinar. Thank you. And thank you for ACHS as well. Like, this is a wonderful school, like a wonderful university, for giving me this opportunity. So I also want to give, ACHS their flowers, because they definitely deserve it. So thank you.
Thank you for sharing that. Let's see. Yeah, Brandy said that's where a larger and more comprehensive intake form comes into helping treating each individual patient. Absolutely. We have a few more minutes here. Does anyone else have any questions or comments? This is meant to be a discussion, and an honest discussion. So, any comments that you think you want to, get out there before we wrap up here? I'll give it another minute. Just,
I have a question for anyone that's in this webinar. You have your clinic who's up and running or about to start. How are you going to, have the diversity in your clinic? What actions are you going to take? Also, like the hurdles that I've told you about, how are you going to get that support? How are you overcoming this at the moment? Do you have anyone support?
yeah, where do you need support too, right?
Exactly.
Yeah, what would be beneficial for you for support?
Right. I know that's a big task, reversing the unreversible. Yes, Roy. That's going to be difficult, but we have to start somewhere.
Yeah, and this doesn't have to be a clinic either. This can be, if you're a holistic nutritionist, if you
Exactly.
are a wellness consultant, if you're a health coach, where do you feel like you need support in this area? Or even as a student before you're in the industry.
Oh, nice. I have a friend who speaks Spanish who will be coming to help translate. Nice.
That's awesome.
Uh-huh. Diverse mentors, meeting folks, doing work, continuing to educate yourself, listening to community of what the needs are, doing self-work to keep how the self feel while doing the work. Oh, yes. Asking ancestors, create guidance to keep on going. Yes.
Medical leaders, BIPOC
Mm-hmm.
leaders, serve my community, undermine communities with medicine and resources.
Yes.
Yes. Self-work is essential.
Yes, it is.
Yeah. And I'm curious, acupuncture becoming ethical vegan curative. Not sure what that message is, but I'm trying to incorporate neurodivergent friendly self-care, and understand that myself and anything else, just trying to be aware, and unprogrammed old beliefs.
Right.
Thank you so much for sharing that.
That, yes.
Yeah, thank you so much for being open and honest about all of that. I want to help reverse diseases, share no testimonial, made my family believers. I'm curious, as far as support goes, this is, obviously the first webinar we have done, Taryn and I together on this topic. And I'm curious if there are any other webinars that you'd like to see, under the diversity, equity, and inclusion umbrella. I'd be happy to gather resources, have some ideas for future webinars. So as far as support goes, from ACHS's standpoint, like how can we support you? What can we offer you? Decolonizing traditional practices.
Yep. I'm agreeing with everyone in the chat because you guys are stating some good facts.
Julie said, I am fortunate to work with a diverse team that's willing to share experience so we can all grow in our
Right.
deep skills. Holding space. Yeah, this is great.
Right.
So continue to share here. Charmaine said, I'm only a second year. I do not know where to start. I want to start volunteering with domestic violence survivors and really see the need for how herbalism can be incorporated there. And assisting with mental health. Well, I think mental health is definitely a huge piece of the puzzle.
Yes.
Definitely.
Mhm.
And trauma, like you mentioned before.
Yes, definitely childhood trauma, just trauma in general, like generational trauma, like
Right.
trauma.
Trauma-informed care. Yeah.
Yes,
And taking additional classes to educate yourself
exactly.
on that, I think is really important. So I'm going to compile, if I didn't get your comment or your question, I'm really sorry. I'm trying to do my best to kind of get these. I know there were some questions maybe that I didn't get to. I do get the transcript of this, so I will definitely follow up with you all individually. And all of those that said yes, that you want to network, I will, by early next week, have that information out. And then, if you are interested, if you are joining us today and you're not a student or alumni, our next start date is coming up February 29th. Taryn did graduate from the MS in Herbal Medicine program, but we have a lot of other programs that are really specific to herbal medicine and coaching. Obviously, we don't offer an acupuncture program here, but if you are interested in acupuncture, once you graduate from ACHS, let me know and I can get you some resources for that as well. And I just want to take a minute to just really thank everyone that attended today, and letting me just learn with all of you and be open and vulnerable. And I just really want to thank Taryn for sharing your story, for just your energy that you bring. And I'm really excited to hear how this practice, ends up coming to fruition for you. And I'm just so happy that you're a community member here at ACHS. And I just really appreciate your honesty and your forthrightness today, just sharing your story. It's awesome. And I think that you gave everyone just a lot of really great things to chew on and think about. And I just want to give you a big thank you today.
No, thank you. Like, thank you.
Yeah, and thank you all so much for being a part of the discussion today. I think this is really important, and you guys are fabulous. Thank you for being a part of the community here. If you want to reach out to me directly, this is my contact info. Again, if you need any support, if this brought anything for you, I want you to just contact me, and even if I can't help you with what you're dealing with, I can get you to somebody who can.
Right.
So with that, I want to wish you a really great Thursday.
Thank you.
Thank you all so much. Enjoy your day.